Good morning. What a pleasure it is to be with you. Thank you to the Carter Center and the Atlanta Press Club for inviting me to join this meeting of the foremost authorities in mental health and substance use. It is so important to keep these conversations going and to foster an environment where answers and solutions can be explored. It is a particular honor to be part of a conversation that builds on the advocacy of former First Lady Rosalynn Carter. Mrs. Carter was a pioneer 50 years ago when she championed the principle that health is a human right, and you cannot have true health without recognizing mental health as a critical component. The recent recognition from the World Health Organization for her work in improving global health reflects just how influential Mrs. Carter's voice has been. She continues to be a strong voice for mental health and substance use care, and with her characteristic courage, fortitude, and grace, she urges us to move forward on this critical issue. CDC has been honored to partner with the Carter Center on this important issue over the years, including our support of the Rosalynn Carter Georgia Mental Health Forum. The most recent forum introduced the unified vision for transforming mental health and substance use care as a roadmap for accelerating effective mental health as the nation struggles with the tragic and pervasive mental health impacts of COVID-19. Here in the United States, we have made great progress in the fight against COVID-19. And while I'm not yet ready to declare victory, I'm cautiously optimistic we are on the path to a more normal world, or shall I say, an even better normal world. As each week passes, the decreases in cases, hospitalizations, and deaths give me hope. As we do the hard work of vaccinating the entire country, one by one, we are helping people make informed decisions about vaccinations, and we are working with public health leaders to make data-driven policies about how to safely get back to the activities we lost during the pandemic. Still, we know that as the pandemic has progressed over months, behavioral health, mental health, and substance use issues have increased. COVID-19 not only exposed old cracks in our public health infrastructure, it intensified a broad range of factors that drive disparities in mental health and emotional well-being, including food and housing insecurity, coping with loss, and racial and ethnic disparities. The greatest burden has been carried by those who are already struggling. We also know that the pandemic has taken an enormous toll on our youth. A CDC study published last summer in the Morbidity and Mortality Weekly Report found that younger adults, racial and ethnic minorities, essential workers, and unpaid adult caregivers reported disproportionately worse mental health outcomes, increased substance use, and elevated suicidal ideation during the pandemic. Another study recently published in JAMA Pediatrics found a staggering number of children, an estimated 37,000 to 43,000, were left orphaned by the COVID-19 pandemic, with Black children disproportionately affected. Tragically, the impact of those deaths will be felt for years to come. I find these data extremely concerning, both as a mother and as a physician. I can tell you that CDC is working hard to support children and their families on a number of fronts. We know what young people need to help them move forward. They need knowledge and skills, access to services, and strong connection to family, peers, and schools, often referred to as connectedness, to soften the blow of how much trauma they have experienced. We are addressing the mental health effects of isolation and remote schooling. I have said from the very beginning of my move to CDC that science and data would always lead the way, and those data confirm that we have the tools necessary to get our children back to in-person instruction safely, equitably, and fully in the year ahead. And of course, it's not just the children that we must consider. Millions of healthcare personnel responding on the front line have also felt this pressure. A surge of new cases of depression, anxiety, and insomnia, plus worsening of existing mental health issues, particularly among nurses, has been attributed to limited resources, overwhelming workload, longer shifts, disruption to sleep and work-life balance, process inefficiencies, occupational hazards, and concerns about health and financial stability. I saw these, lived these, firsthand with my own healthcare workers, my colleagues and dear friends at Massachusetts General Hospital. President Biden and all of the Department of Health and Human Services understand the need and are working vigorously to make behavioral health services available and accessible. We are making a $3 billion investment in mental health and substance use block grants, the largest aggregate amount of funding to date, and establishing a new HHS Behavioral Health Coordinating Council to address the nation's behavioral health needs. And I am truly honored to be co-chairing the Council's Subcommittee on Suicide Prevention. I want to thank the Carter Center and each of you for all you are doing to help America get back on her feet. We are all in this together, and together, connected to each other, we can see our way out of it. I know the work you are doing will help lead the way. Thank you.